Hi friends, I'm Dr. VG Mohan Prasad, Chairman of VGM Hospital and VGM Foundation at Coimbatore, Tamil Nadu. So it gives me a great pleasure to talk to you about one of those problematic diseases, the inflammatory bowel disease. So inflammatory bowel disease is of two major types. There are other minor types, but the major types of ulcerative colitis and Crohn's disease. So the ulcerative colitis is the one which involves the large intestine, and the Crohn's disease can involve the small bowel or the large bowel. The ulcerative colitis presents with diarrhea, blood and mucus, and the Crohn's disease presents as diarrhea sometimes as pain also. So, what causes this disorder is a $1 million question. And the jury is still out in spite of a lot of research happening around the world for decades. Something triggers this disease and it perpetually goes on. So that is the biggest challenge. So it is a long-term disease and there is no one-time cure for this disease. That's sad, but I'm sure a lot of research is on. We should surely be able to break this problem and solve this puzzle maybe in the future years to come. So I used to tell people that my patients that this is like an internal warfare, like our own army going and fighting the lining of the intestine. This is what happens in both these disorders. So it is like a simile, an analog or a simile is the Kargil war, where our, all the checkposts, the army checkposts, usually are vacated in the worst winters. The army people go back to their regiment, and the checkposts remain as such, unarmed and unmanned. So the terrorists took over, and once the army recognized, it started a warfare, and this war produced a lot of damage to the place. But once the Kargil war was won, the regiment went back, the army went back to the regiment. So this is what happened. So and then everything returned to peace in that area, in the terrain. But here, our army thinks there is an invader still sitting there and keeps on dropping bombshells. So first moral of the story is that one needs to understand this cannot be completely cured, but it can be ameliorated. The inflammation can go down with proper medication. So the aim of treatment in both the disorders is one, to reduce the inflammation, reduce the warfare that is happening inside, and prevent futuristic complications. So not at all times the symptoms are on the height. There are very many days when these symptoms will be low and one need not worry. So there have been people going into terrible depression because of this disease, which is not required. This disease could be genetically programmed inside our human body, and then the trigger comes from the environment. It can be bad bacteria, it can be stress, it can be so many factors in the environment which could play a joint role to trigger this process. So it can run in families. So one needs to understand the nature of this disease so that he or she should always, not to go for window shopping from one doctor to another doctor, or one specialization of medicine like Ayurvedic or Siddha or homeopathy, and then come back to allopathy. And some of them discontinue the medicine that they're on, and then again, to get a flare, and then they come back. So these sort of problems can be avoided once people understand the nature of this disease and the trigger is unknown. So once the trigger is found, then there can be a cure for this disease. So The therapy is like a pyramid. You start with mesalamine, which is an anti-inflammatory drug which just heals the gut. And then, comes the budesonide, which is a locally acting gut-specific steroid. And then comes the prednisolone. And then comes the, the immunomodulatory drugs like azathioprine or methotrexate. And finally, the peak is that of the biologics. The biologics are very many, expensive for this country. Some of the biologics can be even oral small molecules, which can be a little bit less expensive for this country. So once we understand the nature of the disease, then we know how to fight and live with this disease and be successful. So there are two clues that can really help. Number one, the rice water. The water that, you soak rice in water and then the next morning you use that rice water along with a little bit of buttermilk and fenugreek. So this combo, regenerates good bacteria, which are called symbionts. They can prevent the bad bacteria from further colonizing and doing more damage. Because people have shown the bad bacteria in the gut mucosal lining or the gut mucosal barrier keep producing a lot of damage. And they play a major role in inflammatory bowel disorders. So you can probably, replace them with good bacteria. Then the war can come down a little bit. The other thing that you can do is in the night, take a quarter glass or half a glass of hot milk with 5 grams of turmeric powder and a pinch, that is 5 milligrams of pepper. This combo can strengthen the gut mucosal barrier, can ameliorate inflammatory response in the body. These two can be adjunctive therapies, but then the pharmacologic therapy is the mainstay. We need to depend upon drugs. There are two ways of doing it. Either you do a step-up approach like what we do in India, or like in the US, you can do a step-down approach. We go from top to bottom, start with biologic therapy and reduce the necroinflammation in the intestine and then maintain it with a low dose. That is also a good approach, an approach which is very useful for diseases like Crohn's disease, especially the penetrating and the fistulizing type of severe forms of Crohn's should be controlled first with biologic therapy, and then we have to come down to the maintenance therapy. So I hope my talk has given you some insight into this chronic disorder which goes on and on relentlessly, but I'm sure we will find a solution very soon for this.